We now move to chapter 13, female breast. We're going to start first with normal breast development. The Tanner stages are predictable sequences of pubertal changes, which include breast changes. There's also pubic hair. So why don't we talk about Tanner stages of pubic hair development and breast development. Tanner stage 1, 2, 3, 4. Tanner stage 1, there is no pubic hair. This is prepubertal. This is normal childhood. In stage 2, the main area where you have the hair is on the labia majora. Stage 3, the hair extends laterally. Stage 4, it extends across the pubis. And stage 5, it extends to the medial surface of the thighs. And that's really the main things with stage 1, stage 2, stage 3, stage 4, and stage 5. None, the labia, the pubis, and extends to the thighs. In terms of breast development, we're looking at glandular tissue, the areolar, and the contours. With stage 1 of breast development, there's no glandular tissue. The areola follows the skin contours of the chest. This is a childhood. Stage 2, the breast buds form with small areas of surrounding glandular tissue. Areola begins to widen. Stage 3, the breast elevates beyond the borders of the areola, which remain in contour with the surroundings. Stage 4, increased breast size and elevation. The areola form a secondary mound. And 5, breast is final adult size. The areola returns to the contour of the surrounding breast. This is mediated through estrogens. And you can see from a frontal view and a side view. The developmental changes are very much induced by hormones. And this looks at 8-week development in utero, 20-week at birth. And you notice at birth, there can be glandular tissue which is present, and newborns can have what is called witch's milk. This is secondary to the hormones of pregnancy. Prepubertal, those areas atrophy. With puberty, we have an increase in the breast size and structures. The lobes contain the alveoli, which produce milk. The ducts carry the milk to the nipples. The adipose tissue is responsible for the size of the breast, and the ligaments give their characteristic shape to the breast. So, a woman who has small breasts and a woman who has large breasts may have the same alveolar ductal tissue. It is the adipose which is responsible for the unique size of the breast. Over time, with loss of tissue turgor, the breasts can sag and the ligaments will reflect that. Here you can see on this picture, we've got the glandular tissue, the lobular tissue, we have the ductal tissue which is in red, but most of it is the adipose tissue, the fat, which gives it its typical contour. Again, here we have the nipple, we have the ducts, we have the glandular tissue, and we have the chest wall muscles. And this is a cutaway which shows this very nicely. Here we have the fibrous tissue which supports it, and here we have the glandular tissue and the fatty tissue, which is more of the yellowish color. Estrogen stimulates the growth of the ducts, the nipples, and the fat. And this is what brings about the pubertal changes. Progesterone stimulates the growth of the lobules and the alveoli, which produce the milk. Prolactin is responsible after birth for the production of milk, and oxytocin is what causes the myoepithelial cells to contract and milk is ejected. Here we have the myoepithelial cells which surround the lumen of the alveolus. And here are the myoepithelial cells. The blood vessels bring in the amino acids, the lipids, the carbohydrates from which the milk is formed. When oxytocin is released with suckling, these myoepithelial cells contract and eject the milk. And here we have a baby enjoying mama's breast milk.